Do you even lift, bro?
But do you even lift, bro, or?
Public prostate exams, do you even lift, bro? And I have no idea what's going on here. What? Get ready to laugh, because today we are breaking down and reacting to all of the hilarious medical scenes and possibly made up injuries from Impractical Jokers. All right, let's dive right in.
Okay, why don't you stand up?
Why don't you administer a hearing test to this gentleman with your own mouth?
Let's just start with your hearing.
Stop
just
it.
raise
What
the
the,
arm whenever you hear
that doesn't
okay?
make sense.
Okay. This is so stupid.
So we do check the hearing, but actually what we do is we just take our fingers and move them together like this next to somebody's ear to actually see if you can hear that. We'll do that. We'll also use tuning forks.
There you go, buddy. Yep, they're fingerless.
What are these things?
You're now infecting all the equipment.
Could you just breathe in slowly for me?
And when you exhale,
No, we don't have gloves like that. If they look like that, that means they've been either faulty or ripped and you need to put new gloves on. I do know that some nurses will take one of the fingers and rip it off because they have better dexterity and can feel a vein better. But again, they wash their hands.
just say born to rule.
And when you exhale, could you just say born to rule?
So he's checking for different heart sounds. That's typically why you do that right in the middle there. But you can also ask a patient to say something while you're listening to their lungs to make sure that the resonance is appropriate.
Born to rule.
Yeah!
All right, so you generally seem like you're in good shape, my man.
Last part of this is just, I'm gonna need you to look into my eyes and fart.
Like, you have to know if you're a patient in this situation that it's not real because she's laughing for no reason, and that typically is not something that happens.
Is right now you're at a conference center.
Yeah.
And when you go into the room and they need a volunteer, you're the volunteer. That's all you're getting.
I'm a doctor of
Nice.
internal medicine. I'm the guy you go to for your yearly physical.
An internal medicine doctor is a very important doctor that we all go to. So you have family medicine doctors, you have internal medicine doctors. They are your general practitioners. But say you want a specialist like a gastroenterologist or a nephrologist, all those specific doctors have to be internal medicine doctors first and go through that training and then do further training in their specialties.
One part of the exam that most guys hate the most. The prostate exam, right?
Maybe not everybody knows what is a prostate and what is a prostate exam. So a prostate is an organ that males have. Females do not have this organ. And basically it produces the semen to form the ejaculate that gets out of our bodies. As we all get older, the prostate gets larger no matter what. So the reason you would do a prostate exam to push on the prostate to make sure that it's smooth, it's not too greatly enlarged, make sure that there is no lumps, bumps that would be concerning for cancers.
What exactly does this entail?
So I'm gonna put some gloves on. I'm gonna put some jelly on my finger. I'm gonna have you bend over.
Oh, God.
Look at this guy. Look at this guy. He doesn't want to watch.
You're gonna take a deep breath and
Crazy.
just let it happen.
We do rectal exams in the emergency department. We're typically not doing prostate exams. When we do a rectal exam, we're looking for masses, we're looking for blood, bleeding, or rectal tone if there's a trauma or a spinal cord problem that we're worried about.
Right part, the right lobe. And check to the left.
You have a finger in your.
Okay, I'm checking the middle. Okay, so far?
You have a finger
Very
in
good.
your.
That's the worst, that he's got like an earpiece and his buddies are laughing at him and he could hear it. Patient's doing good. I mean, if you talk, you laugh, it actually changes the sphincter tone of your anus. And so you just have to be aware of that.
All right, Sal. So we put Dan Cast, our crew member, on the table. There you go. There we go, Sal.
Well, it's discolored, but it is female.
Obviously awkward position, trying to resemble like a female exam or a pelvic exam. Typically, you would put somebody in a type of stirrups where their feet are up, and it just allows the pelvis to be in such a position that you can do your exam. This would be a female exam. Sometimes you can do a male exam where you're actually looking at the scrotum and the perineum, but typically not in this position.
Your name is Justin. Okay, and do you exercise?
I skateboard.
Do you even lift, bro?
But do you even lift, bro, or? And your heart is okay, as far as you know?
As far as I know, yeah.
Yeah, can you feel the difference between love and lust?
It's definitely not a question you would ask about like the heart, history of heart disease yourself, or any family members have any history of heart disease. So typically that's kind of the questions that we'd ask, not these other questions. Again, exercise. Sometimes we can ask this if it's relevant to a chief complaint when somebody's coming into the emergency department versus a checkup that you would do at a family medicine or an internal medicine doctor's office.
Sal, take his temperature using the back of your hand.
So they actually think this is like funny and abnormal, but you can, as another human to another human, you can feel if somebody is warm. So you can get somebody's temperature via thermometer. Typically you want to do under the tongue. That is the best. The best temperature is actually a rectal temperature, but you won't typically do that in this situation. But what could happen is your skin temperature might be significantly warm, but your core temperature hasn't changed yet when a fever is coming. So you might actually be able to tell that somebody is febrile by touching their skin.
Your right leg is dead, sir.
Thank you.
So you're checking your reflexes. We call them DTRs, so deep tendon reflex. And basically it should be a normal response. It's a subjective response in the sense of, is it super strong? Is it really light? Basically it is testing the spine reflex.
Please have a seat.
When did you say your last eye exam was?
When did you say your last eye exam was?
Well, I had one last year.
All right, so we were either at the optometrist's office or the ophthalmologist's office. So the ophthalmologist is an eye surgeon that went to medical school and is a surgeon of the eye. And then the optometrist goes to optometry school, which is different, and typically works on the eye care, kind of health.
You had one last year?
Yeah.
Okay, so you got 2 eyeballs here.
All right, well, you got 2 eyeballs.
So he's using the ophthalmoscope, which basically is the light that allows us to see to the back of the eye, looking at the macula, looking at your optic nerve and the vessels. It also lets us see like the red reflex of your eye.
So do you get headaches?
Yeah.
Or?
Do you get headaches? No,
Good,
no
that's
headaches.
good. I get headaches
I get headaches.
when I wake up drunk in a gutter.
When you wake up drunk in a gutter, you wake up with headaches.
Yes.
If you could look in the hole, yeah, just looking.
So I don't know what kind of device. It's just he probably needs a light on that. If his jaw was shaking and he's having weird muscle spasms, it could be muscle spasms, it could be Parkinson's, it could be Huntington's chorea. A lot of different movement type disorders out there.
There you go.
Just yell out Dick Butkus. Okay. Have you ever, corneas ever been scratched or anything like that, have you? Dick Butkus!
So cornea are highly specialized cells that cover the colored parts of our eye, not the white part. And if they do get scratched, it hurts like heck because they're highly innervated, lots of nerves. Repairing it, depending on how bad it is, sometimes you have to have a contact lens over it, sometimes just a quick antibiotic ointment. Sometimes your eye has to be taped shut to allow it to heal, a lot of different things. Impractical Jokers, very funny. These scenes are quite hilarious, especially because it's kind of like making fun of doctors in a funny way. So if you guys enjoyed me reacting to Impractical Jokers, definitely let me know in the comments. And as always, check out this playlist to make sure you binge watch everything. Please subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.